You are a Foundation Year 2 doctor on a clerking shift in AMU. A patient is admitted with a headache. You diagnose the migraine and commenced treatment. The patient disagrees with your diagnosis and requests that you organize a second opinion. It tells you it will make a formal complaint if you refuse and threatens to sue you. Choose the 3 most appropriate actions to take in this situation. Option A. Explore the patient's reasons for disagreeing with your opinion. Option B. Ask the patient to make a formal complaint via PALS, where they can specify their concerns in writing. C. Request that the patient be transferred to another hospital. D. Clarify that NHS resources are limited and obtaining a second opinion incurs unnecessary costs. Option E. Acknowledge the patient's right to a second opinion and assist in arranging it. Option F. Offer to arrange a review by a senior colleague. Option G. Suggest that the patient pays for an appointment in the private sector. Option H. Discharge the patient with no follow-up. Call security if he refuses to leave. The correct answer is, you can pause the recording and answer. The correct answer is A, E, and F. This scenario focuses on professional integrity. It is important to initially explore the patient's concerns in more details and to understand the reasons for their disagreement. That's option A. It is also important to acknowledge their right to a second opinion, option E, and offering a senior colleague's review, option F, gives the patient the second opinion as requested and improves their confidence in the diagnosis. You are a Foundation Year 2 doctor working on an orthopedic rotation. Your consultant, Mr. Thompson, has been in theatre for a prolonged period performing a complex Girdlestone procedure for an infected hip. The procedure overran and the list is therefore behind. You are aware that Mr. Thompson has not stopped to eat lunch and have a rest before the subsequent procedure. And whilst talking to him, you notice that he appears fatigued and is struggling to maintain focus. You're concerned about his ability to perform the surgery safely and effectively. Rank in order of appropriateness of the following actions in response to the situation. First option. Option A. Monitor Mr. Thompson's performance during the surgery and subsequently raise any concerns with your supervisor. Option B. Contact the on-call consultant urgently, explaining the situation and seeking guidance. Option C. Share your concerns during the surgical team's preoperative briefing. Option D. Discuss your concerns directly with Mr. Thompson. Option E. Propose that Mr. Thompson's registrar takes the lead for the subsequent procedure. You can now pause the recording and write down your answer. The correct answer is D, B, E, C, A. Option D. Discuss your concerns directly with Mr. Thompson. This scenario revolves around ensuring patient safety when you're concerned about a colleague's fitness to perform their duties. Option D is the most appropriate as it involves directly addressing your concerns with Mr. Thompson. Therefore, the surgery proceeds ensuring his ability, he is aware of your observation and allowing him to make an informed decision about his ability to continue. The next best option will be option B, which says contact the on-call consultant urgently, explaining the situation and seeking guidance. It is the next most appropriate action It involves seeking immediate guidance from an on-call consultant who is well placed to discuss your concern with Mr. Thompson and arrange an alternative plan if necessary. The next best option will be option E. Propose that Mr. Thompson's registrar takes the lead for the subsequent procedure. Option E is somewhat appropriate as it addresses patient safety directly by proposing an alternative surgeon to take over. However, it fails to explain your concerns to Mr. Thompson in the first place. The next best option will be option C. Share your concerns during the surgical team preoperative briefing. Option C, sharing your concerns during the preoperative briefing is less immediate compared to option D, B, and E in addressing potential risks to patient safety. It is also less empathetic to raise your concerns in front of a large group. This makes it a least favorable option compared to option D, B, and E. The worst option or the least appropriate option will be option A. Monitor Mr. Thompson's performance during the surgery and subsequently raise any concerns with your supervisor. Proceeding with the surgery fails to address your immediate concerns, placing patient safety in jeopardy, which makes it the least appropriate option to consider.